So we're going to move on to our second talk today by Professor Chris Reid. Chris Reid, for those of you who don't know him, is a cardiovascular epidemiologist with appointments as research professor in both the School of Public Health at Curtin University and the School of Public Health and Preventative Medicine at Monash University. He was appointed as the John Curtin Distinguished Professor in 2018 and is currently the Director of the Monash and Curtin Centre of Cardiovascular Research and Education. Chris is going to talk about the Canary in the Coalmine, how to keep WA mining safe during COVID-19. Thanks, Chris.
Thank you very much. Very hard act to follow, Jeremy, after that presentation. Thanks very much for that. I'd just like to start by acknowledging the traditional owners of the land and pay my respects to elders past, present and emerging. Well, about this time last year, the world was a different place. And we heard this morning, I thought, a terrific presentation from the senior leaders of the COVID response in WA about the modelling, with the expectation that we could have been in for a bit of a catastrophe, not only here in WA but all over Australia. And thankfully it didn't happen, but there was so much work in getting ourselves sort of prepared and ready for what might happen. And I think the WAHTN really put a lot of effort into developing the research response. We've heard from Toby Richards this morning about what was happening in the acute care sector, but at the same time we were looking at what might be happening in the community, and particularly as it was important right at the outset to get a sense of what might happen if the impact of COVID-19 right across the level of community, not only those who have the disease but are highly at risk. And so we really thought we should get engaged. But what we didn't want to do was sort of muck up what was happening at that acute care sector. So we focused on looking at some research at the impact in the community level. And the idea was right, as we've heard from Jeremy, our interest was looking at the long-term physical and mental health consequences of COVID-19. At the same time, we were invited to participate in a meeting set up by Minister Cook with the Council of Mining and Energy in WA, recognising the fact that the West Australian mining industry is an incredibly important part of our community. We know that safe and reliable operations are crucial to the strength of the resource business. And here we are facing a pandemic. What could we do to actually try to keep the mineral and mining industry functioning, operating, and most importantly safe, and most importantly safe in those parts of Western Australia which have a high proportion of Indigenous people, and keeping communities safe was a very important aspect. So we set up what we called the CIVIC study, which is really a comprehensive health implications of COVID-19 in the community. It was really focused around not the acute care sector, but what happened to people when they came out, and looking at long-term follow-up. But as we know now, we actually didn't get a lot of community transmission or community cases of COVID in Western Australia, thankfully. And we also knew that with the cases that were in the acute care sector, we didn't want to compound for those individuals to be targeted by multiple groups, asking similar questions, etc. So we did the first of our pivot points after setting up the CIVIC study. Now we're going to hear from Sean Hood in the next talk about the mental health response, which has been a really important aspect of the work that's been done by that group. But we actually pivoted and we focused, working with the state government and working with the mining sector, on fly-in, fly-out workers, and what we could actually do with industry to try to protect industry, to keep those wheels turning, to keep the mining industry functioning, and to keep communities safe at a time when we really didn't know what actually was going to transpire as the year progressed. So the COVID, or the CIVIC-FIFO study and the DETECT-FIFO study are effectively two parallel groups of activities run through the mining sector, initiated by the Department of Health and the Chamber of Minerals and Energy, linking in with the WAHTN, with private pathology providers, with Clinipath, with Western Diagnostics, and at the same time, Mineral Resources, in conjunction with Australian clinical laboratories and safe work laboratories, were also planning activities to try to keep the industry moving. So we very much aligned. I think one of the good things we've heard about the COVID pandemic is that collaboration is the big word that really came true during that time. So in our activities of doing these studies with industry, we actually ensured that our data sets were aligned. We ensured that our procedures were very similar. But at the time we're doing this, the government actually said that there was not going to be any asymptomatic testing, and if it was being done in the community, it had to be associated with research. So we pivoted our CIVIC study to have a focus around long-term outcomes or health outcomes for fly-in, fly-out workers going up to the mines. And that was the sort of research application of the DETECT and CIVIC studies. We needed a rapid response. We had to go in and design studies, get ethics approval, have our infrastructure in, working with our clinical pathology providers, and have the appropriate governance and oversight to run these studies within a very short period. And I'm really pleased to say we actually had these studies up and running in 8 days, and that included ethics approvals. So we often hear how we struggle with ethics committees, but I'll give a big shout out certainly to Curtin Ethics Committee, who really went well beyond the call of duty in helping us get this program up and running in a very short period of time. It was a fairly simple protocol, and we kept the protocol similar across both DETECT-FIFO and the CIVIC-FIFO. It's a research study, and so one of the messages we had to get to our industry collaborators was that in research, it's voluntary, it's not mandatory. And that was one of the strong messages we tried to get out, and we worked hard and still do work hard with our industry partners. But we had FIFO workers invited to participate at an approved laboratory site. Very simple process, a PCR testing. If they tested negative, they were able to proceed to flights and go up into the mines. If they tested positive, procedures in place, as we heard this morning, to manage those positive cases here in WA. And as part of the research activities, we also established a biobank, linking again closely with Toby Richards and the COVID research response. So all of this research really was integrated, bringing it all together, which I think is really important for Western Australia. The workers, it was open to workers and employees, routine symptomatic testing. We had an incredible response from the resource sector. Over 132 companies subscribed to DETECT-FIFO and are continuing on with this activity today. This was I don't know if you actually went out to Perth Airport at any stage last year. You probably weren't going anywhere, but if you did, you'd have seen this great big marquee set up out in the car park. And in that marquee were the mining industry actually setting up to do rapid or COVID testing for fly-in, fly-out workers. So that was the site that you saw when you went to the airport last year, and after going through that process, you were then able to move through and get onto a flight. We did 77,000 tests in DETECT-FIFO over the course of the last 12 months. We detected 9 positive cases, and they were all historical cases, so no new cases were detected. You can see on the slide there where the initial screening really ramped up in June of 2020, and then we've gone into just a maintenance pattern. But you can see what happens when there's a little bit of a lift in the community. You can see the lockdown, the 5-day lockdown in January, and you can see the spur when we had those cases in April. understandably, the majority of people that were tested during that time were young, predominantly young men, which is reflective of the fly-in, fly-out workforce. And it's really quite interesting. Young men are often very challenging to get involved in longer-term research and to ask them to fill in questionnaires and to participate in longer, sustained activities in research. And so we've struggled to maintain that continuity in terms of being able to get follow-up data on many of these individuals. But I think the key thing is that what this did is to provide confidence in the FIFO workforce and provided confidence for the industry to keep moving. In terms of CIVIC, which was done, they did 105,000 asymptomatic COVID tests were performed over that time. Only 3 historically positive cases were identified. And another 46, so it's nearly 200 companies in Western Australia participated in this activity throughout 2020. Again, you can see this is just a daily look of the cases that we're testing, and again, just looking at that big spike that occurs when anything happens in the community. This program is actually available for industry to respond instantly, just to make sure and just to be able to check that there is no escape of any positive COVID cases into the regional areas where these industries are working. Now, at the same time, we did have that 5-day lockdown, and as the lockdown finished, there was a move to get industry back into the offices, particularly into the city. And we've actually seen many industries have really reduced the number of people that are coming back into the offices, and it's actually been quite challenging in some businesses and some organisations to get people back into the offices. Even more so actually in Victoria, who had a much more of a sustained outbreak than what we saw here in Western Australia. So with Rio Tinto, we undertook the DETECT-Rio Safe CBD study. Again, a very similar model. This was established just after that lockdown was finished. It was looked to monitor people as they came out of the stay-at-home restrictions. And it was thought that actually doing this, the CBD may well be a place where there could be, if there was community infection, more highly likely to be in a place where people were moving around. And so the Rio Tinto industry felt that this was a way in which they could to see how their workforce was progressing in terms of any exposure to COVID. Again, a very simple screening study. We again had to be involved in research, so we also, in association with Clinipath and the providers, looked at some antigen testing, some additional types of measurements, and again, people willing to provide data or provide samples to a biobank. With Rio Safe CBD, we screened just on 3,500 people came back into the office. All participants tested negative, so there was no cases actually reported in that program. The key messages, and it's interesting, it's really difficult to, unlike Jeremy, who's got so much data, I think we have 11 already known positive cases out of over about 170,000 tests that were done. But what the important thing of this activity was, it really focused on keeping regional and remote areas safe, and that is a key health priority, but keeping the mining industry open was also a key economic priority. WA industry was very engaging in this activity and participated through the support of the CME and with the collaboration with the WAHTN and the government. We had to pivot this directly. We changed our focus around not just the symptomatology, as Toby described this morning with the use of the ISARIC protocols, but it really evolved to look at those longer term mental health and outcomes from people with COVID. But of course, we didn't find any, thankfully. The early protocol, importantly, having that early protocol set up, it could have been a very different story here in Western Australia, but we were ready to be able to ensure that none of those cases may actually get up into those areas. And it's really interesting when you look at the community, there's a waxing and waning. We see it ourselves in the way we behave in terms of social distancing, masking, etc., when we don't have any COVID in the community. But I think from Jeremy's presentation, I think we really do have to remain vigilant. Was it a success? Well, there was no COVID-19 in the mining sector. The communities were kept safe. Industry continued. And there was a definite sense of security for those participating industry partners who were sending their workers into those areas knowing that they were actually safe to go to those areas. So thank you very much, and I'm very happy to take any questions. I should acknowledge a big shout out to the team that put this together in such a short amount of time. It was exciting this morning actually hearing the response from Andy Robinson and David Russell Weiss, that sort of sense of anticipation of what was going to happen. Exactly the same thing went through the research sector. How could we get ourselves ready for what might happen? Thankfully, nothing really happened, and that's a good thing. Thank you.
Are there any questions? Just while we're waiting, I just might ask you a quick one. Again, my prerogative. How did you manage that tension between probably what the industry would have wanted to mandate testing of their employees versus the sort of ethical considerations around consent?
Yeah, that's a good one. And that was a bit of tension at the beginning. And there were a couple of newspaper articles, I think, and there was some call-up about, workers concerned that they were being forced to have testing. We made it very clear. We worked very closely with our industry partners, all 132 companies, to make sure that their consent forms were being used, that there was a process. We set up phone numbers where people could call. So we did everything that we felt we could do to ensure the research was done appropriately. And I'm pretty confident in 99.9% of cases it was.
Anne White from the Community and Consumer Involvement. That was my question. About how voluntary was it for the workers, the FIFO workers? You've answered it.
Terrific.
Hi, on the photo at the airport of the staff taking the samples, I might have probably missed it. Did you say how long it took to get the results back?
A lot of those samples were done 2 days prior to taking off, but once it got through the early stages, people were actually having testing and then getting on planes and heading up.
So they got the result back before they got on the plane?
In a lot of instances, yes, but not always.
And one more, when they self-tested? Yeah. Were you happy about that?
Look, that was really interesting. What we've seen over the last year is technology is rapidly changing, and these new ways of measuring, new tests. The self-test kit was a piece of research actually done by Narelle Hadlow and the team at Clinipath, and they actually looked at self-testing versus laboratory testing. In most cases, they were quite happy with the consistency of those results.
Thank you.
Welcome.
Please join me in thanking Professor Chris Reid. Thank you.
Thanks, Mary. Oh, thank you.